Hi everybody, Jennifer Blevins-Smith here with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today's topic is going to be discussing acquiring patients from a retiring provider's practice. Now, the information and the guidance I'm going to be providing could be for you if you are already practicing in the same medical clinic as the retiring provider, or if you're an outside clinic, outside practice that has been asked and to consider absorbing these established patients from the retiring provider themselves. Of course, a responsible provider that is retiring is going to seek out places in the area and other clinics and providers that they trust to absorb and agree to seeing their patients so they don't abandon them and they can help give them a little bit of reassurance. And this is especially important when it comes to general practice, family medicine, because those patients have developed quite a relationship and trusting bond with that doctor. And if someone is suggesting that they see another provider because of their retirement or they're going to be leaving the area, they will take that seriously because they know that they would be in good hands. So if someone is asking you to absorb their patients, chances are you should take that as a compliment and be flattered, because that means they are trusting you with the care of their patients. So this video is going to go about what to look into when it comes into the patient population and reports to run and things to consider. And then my next video is going to be about acquiring or purchasing an established practice, whether you're going to be expanding your current practice and have multiple locations, or if you are starting your own practice but you would rather absorb something that's up and running instead of starting from scratch. So that will be more of a business aspect, and that will be my next video. But today we're going to talk about things to consider about the patients when you're looking at absorbing a practice or absorbing patients from a retiring or doctor that's leaving the area. So the first thing you want to think about is your current status with your current patient load. If you're already established and you're already practicing, you want to make sure that you can take on these extra patients and that you're not going to create a situation in your office or in your personal schedule that's going to delay any of your patients from being able to be seen in a timely manner. That means you want to see how long patients are already waiting to be seen by you, and that's not just for urgent or acute care issues, but also for people who are needing to do follow-ups or physicals if you do those, or any kind of maintenance appointments. The number one thing you want to remember is that it's about the patients and the care you provide. Yes, the money aspect can sound good about growing your practice and having a higher patient volume, which usually in turn means increased revenue, but you don't want to stretch yourself too thin, and you don't want to put your patients in a place where they're getting delayed care because of it. So you definitely want to be in touch with your front office staff, your manager, and find out exactly the true length and waiting times that people are having to wait to be seen by you. And I would approach it, like I said, from acute care and also from sick visits and maintenance visits and physicals. And depending on your specialty, of course, those are going to be a little different, but you kind of want to look across the broad spectrum of all different kinds of appointments and what patients schedule to see you for. The second thing that you want to look at is how often are you scheduling appointments in your schedule? If you're seeing patients every half an hour and maybe you can squeeze some in and change to every 15 minutes to accommodate that load, maybe that's very practical for you and you're able to still provide quality care in those short amount of times. So if it looks like it might be a stretch when you look at your existing patient base, maybe consider changing some appointment length times, or consider maybe hiring a scribe so that you're not trying to document while you're in the room with them, if that's something that you do, and anything that can speed up you seeing patients but still be able to provide quality care. Maybe it has to do with changing some workflows in your office and having certain staff members do additional tasks and duties by training them and designating them instead of you doing them. There's a lot of different options, but it's definitely something that I would bring in your manager, your back office lead, your front office lead, and even your billing folks to kind of consider, because they will bring up different things and aspects and angles that maybe you haven't considered. The other thing that you need to consider is what kind of insurances the patients that would be seeing you have, and comparing it to the established patient load you already have and what is the percentage and breakdown of insurances that those patients have. As much as everybody would love to see Medicare and Medicaid patients, it's really hard to have a private practice, especially a small private practice, and having over 50% of your patients having those insurances. That is because the reimbursement is a lot lower usually than your commercial payers. So if you have a retiring doctor wanting to hand over a bunch of patients and they're all Medicare and or Medicaid, it might not be in your benefit to be able to do that just as a business situation and being able to pay your overheads. Because if you have increased patient volume, it's probably going to mean that you're going to have to hire additional staff in some places, maybe billing, maybe back office, maybe front office, maybe all of them, depending on how large you are going to absorb of that patient base. But you need to make sure that it's going to be beneficial to you. And of course, usually Medicare patients do take a little bit more time in their appointments because they require a little bit more care because they have more complex health issues, and that's something you need to consider as well. You also need to consider how far people would be driving and if it's even, a likelihood that they would come to you. Just because the doctor's asking you if you would be willing to absorb them doesn't necessarily mean that patients are going to choose to see you. It's still the patient's choice, and the likelihood of them coming to see you at least once to see how they like it is probably pretty high. But just be sure that you're considering where the established provider's patient base is mainly located, and if you're a little bit further away than what they're used to driving, what is the likelihood that they're going to come to you. The other thing that you need to consider is the age of the population. So maybe these patients are not quite on Medicare yet, but maybe they're really close within the next 3 to 5 years. And then you look at your patient base and the ages of your patient base, and it's the same way, and you find yourself in 3 to 5 years having a majority of your patient population being Medicare age. Now, this isn't something that might deter you from accepting and absorbing these patients, but it is something that you will need to anticipate and maybe needing to bring on additional providers in the future, maybe a mid-level like a PA or an MP to help with those. Because like I said, Medicare age people generally have more complex health issues, and they're going to need longer visits if you can justify it with your billing and coding and your reimbursement. So that might be something you'll need to consider down the road, is if your patient population is aging to the point where they're going to need a little bit more TLC. Now, this is the reality of any practice, especially if you're in general practice family medicine. You start off early and get the young patients, and then they love you and they stay with you, and eventually we all get old, right? So that is something you need to consider in your private practice no matter what. If you're in a specialty, you kind of have a little bit more of a luxury of not having to worry about some of this because people see you as needed a lot of times. Like if you're in ortho, or you're reimbursed a lot better than general medicine, family medicine. Unfortunately, our GPs are reimbursed a lot lower than a lot of specialties. So, some of this might not be applicable to you, but we are in a state of needing more general practice providers. And these are things that need to be considered, especially if you're going to be opening your own practice. And eventually, I'm sure you're going to be approached to absorb a retiring doctor's practice, or at least their patients. And these are things that need to be thought about. I would also ask the doctor that is approaching you what kinds of treatments and how they practice medicine, basically. I would ask them, because maybe there are things, modalities, treatments that you don't provide that their patients might expect you to provide, and it would be kind of a letdown, or they are used to a certain way of a practice and you're going to have to, quote, retrain these patients. And it's not impossible, but it can be really hard on your staff. I've been in situations where we have absorbed other doctors' patients, and they do things kind of more old school, where we did things more new school, if you will, and had a little bit more regulations and compliance, and patients had a really hard time adjusting to that, and they would get angry at the staff, and I had to put out a lot of fires as a manager. So maybe it won't deter you from saying yes to absorbing these patients, but maybe it's something that you need to be aware of so that you can prepare your manager and your staff on how to handle those situations if they were to come up. It's always good to look around every corner and make sure that you're not setting yourself up for failure, but you're not going to be asking too much of your staff and burning them out or putting them in positions where they're getting yelled at or being treated unfairly by patients. If you are going to be accepting patients from a retiring provider's office, I would suggest drafting up some kind of welcome letter. So if they provide the information when they schedule that they're transferring from so-and-so's office because they're retiring, then your staff knows that there could be a special letter to put in the new patient packet to provide to them, and just kind of laying down how you do things, your expectations, and hopefully to try to avoid some of those frustrations and the patients being upset because it's right out there on the piece of paper up front. And it makes them feel a little bit more welcomed and special if you are expecting them and you have something just for them to directly communicate and acknowledge that they are new to you from Dr. So-and-so's office. Definitely don't want to treat them any more different than that, but sometimes a little bit of extra finesse on the beginning welcoming side could go a long way, especially with retaining patients and for them to treat your staff nicely. If you have any experience with absorbing retired providers' patients, no matter what your specialty is or your focus, please leave that in the comments below, because any kind of information or tips that you can provide to your colleagues would be very helpful. If you have any questions for me, please leave it in the comments. Smash that thumbs up button if today's video was helpful, and make sure you tune in to my next video. Like I talked about, it's going to be more from the business angle of either buying or acquiring a new practice that is already established but new to you to think about before you make that leap of faith. Have a wonderful day, and we'll talk to you soon.